Healthcare experts have advised the public to take preventive measures against diseases associated with the Harmattan. The dry, hazy and dusty weather increases respiratory infections such as asthma, especially in children. A Neuro-pediatrician at the Korle-Bu Teaching Hospital, Dr. Ebenezer Badoe, says some microorganisms which cause diseases increase during the Harmattan. A report by Neuro-pediatrician.
Season is usually a dry and dusty period associated with low humidity. As a result, the weather is harsh to the hair and skin as well as other internal organs of especially babies.
Children have a small respiratory cage. They have a narrow airway. So if you have a little bit of mucus or anything just narrowing it, then suddenly they're in trouble.
Harmattan gives discomfort to people with certain allergic conditions. They tend to have more attacks because Harmattan carries dust, pollen grains, and other allergenic materials capable of triggering attacks.
You have winds blowing from the desert coming down, and those are fine particles of sand in the air. That's what gives the haziness. So on those particles, then little bugs called viruses then can stick to it, and then we breathe it in, isn't it? So it goes through and penetrates our nerves, and then respiratory illness starts. So for this season, you are talking more of respiratory illnesses affecting children. So lots of viral ones, colds. In those who have asthma too, colds go on to initiate asthmatic attacks. So you get children with asthma and children with that kind of problem, bronchospasm or allergies, more of them presenting. Then, of course, others too can go on to develop pneumonia. If you have eczema as a condition, I can imagine that it will worsen because you need to moisturize also very well. Even children with sickle cell disease too who get bone pain.
Harmattan season require appropriate clothing to reduce incidences of respiratory infections. It is safer sometimes to wear sunglasses to protect the eyes. Dr. Badoe entreated the intake of much liquid, especially water from safe sources, fruits and vegetables containing much vitamin C to prevent infections and aid recovery.
We have a more open environment and we all breathe the same air. So a lot depends then on our own immune systems. But like anything else, if your diet is good, you eat well, then your immune system is also functioning better, and then you prevent most of these illnesses.
The watchword is dehydration. The application of shea butter can also provide relief for children who present with dry skin or chapped lips. Neuro-pediatrician, GBC 24, Accra.